A very warm welcome to our respected judges. I am Ayushi Thakkar from Maharashtra. Today, the subject of my talk is solid unit dosage forms other than tablets. Now, let's move to the first part of my talk, which is a basic introduction to a unit dosage form. Solid medicaments may be administered orally as pills, cachets, capsules, tablets, lozenges, dry powder inhalers, and chewables. These dosage forms contain a quantity of drug which is given as a single unit, and they are known collectively as solid unit dosage forms. Here is a classification of solid dosage forms. It can be classified as unit and bulk. Since our topic of concern is solid unit dosage forms, we would be considering several examples under it. They are as follows: tablets, capsules, lozenges, cachets, dry unit dose inhalers, pills, chewables, granules. From here onwards, I would be explaining each solid unit dosage form in detail along with its definition, classification, and some examples. Capsule is a solid unit dosage form in which drug substance is enclosed in either hard or soft soluble container or shell made up of gelatin. Classification. It can be classified as hard gelatin capsule and soft gelatin capsule. This is a table presenting a basic difference between a hard and soft gelatin capsule. So, hard gelatin capsule consists of two pieces, a large body and a short cap, whereas a soft gelatin capsule is a single piece that is hermetically sealed. Hard gelatin capsules are mainly cylindrical in shape, whereas soft gelatin capsules are available in variety of shapes like round, oval, tube. Mainly powdered drugs and pellets are encapsulated in hard gelatin capsule shells, whereas liquid and semi-liquids are filled or encapsulated in soft gelatin capsule shells. There are 8 different types of sizes available in form of hard gelatin capsules, starting from 000, which is the largest size, followed by 00, 0, 1, 2, 3, 4 and 5, 5 being the smallest size. And in case of soft gelatin capsules, there is no specific size available. They are available in variety of sizes. This is a picture representing different parts of hard gelatin capsule. It consists of different parts, each part serving a unique purpose. There are two aerodynamic air vents that allow air to escape from the cap. Then there are two rounded hemispherical ends which are mechanically stronger and more resistant to deformation. Then there's a tapered rim of the body that engages easily with the cap for problem-free closure. Then there are 6 elongated dimples that maintain precise round capsule diameter, improving filling machine performance. And lastly, there are closely matched locking rings that provide full circumference, leak-free closure. Here are some examples of solid filled hard gelatin capsules. I would like to figure out a few examples like amphetamine and dextroamphetamine capsules which are sold under brand name Adderall XL. Then methyl phenidate hydrochloride sold under brand name Ritalin LA or Novartis. Now there are few examples of liquid or semi-solid filled hard gelatin capsules like vancomycin sold under brand name Vancodin, captopril sold under brand name Captopril R, then ibuprofen sold under brand name Solufin, and finally piroxicam sold under brand name Solicam. Again, we have this endless list of examples, so I would like to mention a few. These are the examples of soft gelatin capsules like retinol or vitamin K capsules sold under brand name Aquazole A, then digoxin capsules sold under brand name Lenoxicap, ranitidine HCl capsules sold under brand name Zantac, then diphenhydramine HCl sold under brand name Unison Sleep Gel. Now I would like to change direction and talk about dry powder inhalers. A dry powder inhaler is a device that delivers medication to the lungs in the form of a powder. These devices are most commonly used for drug delivery in the treatment of asthma and chronic obstructive pulmonary disease. Directions to use. The medication is commonly held either in a capsule for manual loading or in a proprietary form inside the inhaler. Once loaded or actuated, the operator puts the mouthpiece of the inhaler into their mouth and takes a sharp, deep inhalation, holding their breath for 5 to 10 seconds. The figure here demonstrates three types of powder drug inhalers like Turbuhaler, second one being the Accuhaler, and the last one being an ellipta device. DPI formulations may either be fine powder drugs having particle size less than 5 micrometer blended with larger carrier particles, generally lactose, to prevent aggregation and increase powder flow. A drug particle size between 1 and 5 micrometer is needed for entry into the deep lung by inhalation, and particles of 1 to 2 micrometer are most suitable for reaching the small airways, an important anatomical target for the treatment of asthma and COPD. So now we come to the next point, which is lozenges. Lozenges are disc-shaped solid unit dosage forms that contain drugs and flavoring agent in a hard candy or sugar base. They are intended to slowly dissolve in oral cavity, usually to produce local effects. Examples: dextromethorphan hydrobromide lozenge, dichlorobenzyl alcohol lozenge, amyl metaclozole lozenge, and coughlin cough lozenges. Of course, we all are more familiarized with strepsils and copsils. Going through a classification of lozenges quickly, they can be classified according to texture and composition into four subclasses: chewy or caramel type, compressed tablets, soft lozenges, and hard candies. And based on site of action, they can be subclassified as local acting and systemic. Now let's move attention to the next point, which is catchets. Catchets are the solid unit dosage forms of medicament in which the drug is enclosed in tasteless sheet made by pouring mixture of rice flour and water between two hot polished revolving cylinders. Water is evaporated and a sheet of wafer formed is called as catchet. There are two types of catchets: wet seal catchets and dry seal catchets. Examples are sodium amino salicylate catchet and isoniazide catchet. There's a specific way to administer a catchet. It should be immersed in water for a few seconds and then placed on tongue and swallowed with water. Next solid unit dosage form described here is pills. Pills are small, round, solid unit dosage form containing a medicinal agent intended to be administered orally. Examples are birth control pills or oral contraceptives, which are quite common, norethindrone, ethinyl estradiol. These are monophasic oral contraceptive pills that contain a constant amount of estrogen and progestin in each active pill. And second example being Lostin 20. Though chewables are also classified under tablets, they can be considered as a separate solid unit dosage form. They are basically large in size and are intended to be chewed in the oral cavity before swallowing. Some examples are ibuprofen chewable tablets, which are meant for relieving pain and reducing fever, and it comes under the category of NSAIDs. Second example being loratadine chewable tablets, which are antihistaminic and they are mainly used for sneezing, runny nose, itchy, watery eyes, or itchy throat or nose, and indoor and outdoor allergies. Next example being Tylenol or acetaminophen chewable tablets. Lastly, I would like to explain a few advantages of solid dosage forms. Solid dosage forms are more stable than liquids with longer expiration dates. They can be easily shipped and handled. They require less shelf space. Since they are a unit dosage form, they have higher dose accuracy and less content variability. No preservation requirements are necessary. Now, let's discuss few MCQs in order to enhance our understanding about this topic. First question, the following steps are involved in the hard gelatin capsule shell manufacture. A. Dipping, B. Spinning, C. Drying, D. All. The correct answer is option D. There are 5 steps involved in hard gelatin capsule shell manufacture: dipping, spinning, drying, stripping, and trimming. Second question, examples of drug dispensed in soft gelatin capsule are A. Volatile drug, B. Powder, C. Vitamin A digoxin, D. All of the above. Right, correct answer is option C. Vitamin E and digoxin. Next question, which of the following is not true of a typical dry powder inhaler? A. DPI are difficult for patient to coordinate. B. DPI may contain the powder in a unit dose or reservoir. C. DPI requires high velocity airflow to aerosolize the powder. D. DPI liberate fine particle powder upon inhalation. So the correct answer is option A. Instead, DPIs avoid the difficulty of coordinating inhalation with device actuation that may be experienced with pressurized metered dose inhalers. Next question. Lozenges are solid dosage forms intended for A. Faster action, B. Slow dissolution, C. Slow disintegration, D. None of the above. Correct option is option B. Slow dissolution. Catches are also known as A. Capsules, B. Microencapsules, C. Microemulsions, D. Water capsules. The correct answer is option D. That sums up my presentation on solid unit dosage form. Well, I hope I have covered necessary points that I needed to present today. Finally, I would like to thank Academic Decipher for organizing such a wonderful competition through which I could at least portray a part of knowledge through this video making competition. Thank you.